I'm Steve Adubato. This is part of our Community Health Beat series. Proud to introduce Dr. Poonam Aleg, who is the former commissioner of the Department of Health and Senior Services in the great state of New Jersey, a physician with the New Jersey Veterans Administration, and also on the board of directors of an organization called?
The Common Sense Institute of New Jersey.
What's that?
It's actually very interesting. It is a nonpartisan public policy think tank. It is an avenue or a venue where you look at all the public policy issues affecting New Jerseyans, either through legislation, either through what's happening at the federal level. Look at how that's going to impact New Jersey and identify market-based solutions as a result of scholarly research, but also pragmatic solutions. So it's very, very interesting. It's the work I love. It's an extension of what I was doing at the department, and it's truly gratifying.
Let's talk about practical solutions, common sense, the Veterans Administration, your involvement there. Talk about it. Because veterans face incredible health challenges and other related challenges.
Steve, the veterans are very, very close to my heart. I've been working with them through training. I've always kept a practice on the side no matter what I've been doing in my professional career. And the governor was very gracious. He let me continue working with the veterans. Even
when you're the Commissioner of Health?
During my time as Commissioner, I was volunteering with the veterans. And they are a very, very special group. They've served our country, they've sacrificed for our country, and when they come back here, no matter what war they've fought, they do feel as though they need resources to help them adjust to the civilian life. The Veterans Administration here in New Jersey is doing a spectacular job. It is truly a model of integrated healthcare with 2 main medical campuses and 10 outpatient clinics where our vets can come in and get services in terms of mental health services, medical services, physical services, substance abuse, residents, support with residential, accommodations.
By the way, stay on that for a second. Someone logs on to that website. What can they find out?
They can identify all the resources that they need, both from an outpatient as well as an inpatient perspective. We have, some of the things that we're talking about, healthcare reform in terms of care coordination and having that single point of entry and identifying the support system that vets need or people need in order to stay with independence and autonomy in the community setting are examples of what's happening within our veterans' healthcare system.
Let's stay on the issue of healthcare reform. Again, you see this from so many perspectives. As a clinician, as an executive in the government, as a top-level cabinet member in the Christie administration. One of the issues that keeps coming up, and I wonder with respect to healthcare reform whether there's any benefit to it, we clearly have a shortage of primary care physicians. Is there any aspect of national healthcare reform that helps in that regard?
The access to primary care physicians and physicians in general is a real issue. And again, if you look at basic, principles of economics, it's a supply and demand issue. The supply is an issue. By the year 2020 here in the state of New Jersey, we're going to be dealing with about a shortage of 3,000 physicians. And that's without taking into consideration the increased insured population as a result of Medicaid and healthcare reform. So when I look at...
Meaning the demand's going to get greater.
Demands are going to be greater, right. So the supply, we're not going to be able to meet it as a result of supply because it takes at least 10 years to generate a physician. So when I looked at this from a public policy perspective, I look at it in 3 perspectives. How do we cultivate more physicians? How do we retain more physicians? And how do we attract more physicians? In terms of cultivation here in the state, there's a lot of great work that's being done, whether it's the Cooper Medical School, whether it's initiatives like St. Peter's with Drexel and coming up with a regional medical campus, whether it's looking at NJIT and identifying other ways of bringing physicians here. I think that's going to be very important. Looking at GME reform, which...
What's that, graduate medical education?
Graduate medical education. And that's something that our governor's already started in terms of some of the budget proposals and budgets that we've signed off on.
But Doctor, as a clinician, you also understand by talking to your colleagues or those who choose not to be colleagues because they choose other professions. Can you understand why some of the best and the brightest say, no, I'm going to pass? I thought I'd want a career in medicine. I thought I wanted to be a primary care physician, but reimbursement rates, medical malpractice, the bills I have to pay for medical school, I don't see it. Do you see that a lot?
I do see that. And
What do you say to them?
I do hear that frustration. However, there is no better time to be a physician than right now, because we have the ability as physicians to be at the helm of change. Everything that's in healthcare reform is around physician-led initiatives, physician actually managing the care, physicians being responsible for coordinating and managing outcomes. So things that physicians lost, in the past few decades, where we had to be, sort of evaluated, and there was, the third party coming in telling us what to do and what not to do. Aspects of healthcare reform will give that flexibility, that give that autonomy back to physicians. So we need the best and brightest. There is so much happening in terms of genomic medicine. There's so much happening in terms of integration in our healthcare delivery model. The model that we have right now is an acute care delivery model. We have to transform that to a chronic care delivery model.
What do you mean?
When you look at our population, if I step back and I say, okay, what are the issues that are truly affecting us as a society today? The two biggest issues that hit me is the fact that our population's aging. And when our population's aging, so is the chronic disease burden. So diseases like HIV and AIDS, when I was training, having that diagnosis was almost like, okay, your prognosis is fatal at this point. Now patients are living with that disease as a chronic disease. You look at cardiovascular disease. You see mortality rates declining in cardiovascular disease. So our current delivery care model is more of, treating coughs and colds and back pains and sprains. How do we manage that so that we're coordinating care?
One more quick question. I got 30 seconds left. Biggest difference between healthcare access and delivery in urban versus suburban areas in the state?
I think the access is a very important issue, and that's why some of the models that are out there, for example, the Camden County model that's there with the Jeff Brenner model.
Dr. Jeff Brenner.
With the Jeff Brenner model, where we're identifying that 80-20 rule. What are those, 20% of your population that's resulting in 80% of the cost? How do we bring them into the system? And they're the low-hanging fruit, and how do we manage that care? Because if we can manage that the lowest tier of health care in terms of access, then guess what? The entire healthcare system is elevated. So I think that's going to be extremely critical. Healthcare is local, and you have to identify solutions at the local level.
Thank you, Commissioner. I can still call you that, right?
Yeah, you can still call me that.
Once a senator, once a commissioner, once a governor, always. Thank you, doctor.
Thank you so much.
You helped a lot.
Yeah,
Appreciate
thanks
it.
so much.
Be right back after this.
This Community Health Beat segment has been brought to you by the Healthcare Foundation of New Jersey.